تكذبان هل جزاء الإحسان إلا الإحسان فبأي آلاء ربكما تكذبان صدق الله العلي العظيم.
اللهم صل على محمد وعلى محمد. ما شاء الله.
MashaAllah, Jafar, thank you for that beautiful recitation. We will now begin our seminar, and I would like to welcome our panel of medical experts. Our first expert is Dr. Salam Al-Attar. Al-Attar specializes in family medicine and is currently practicing in Toronto. He completed his medical degree and postgraduate education at the University of Ottawa in Canada. Welcome, Dr. Al-Attar.
Assalamu alaikum wa rahmatullah. Thank you all for this warm welcome, and more importantly, thanks to Allah subhanahu wa ta'ala for this opportunity, inshallah ta'ala, to be with you, and inshallah ta'ala to learn with you along the way, inshallah, as we endure the challenges of this pandemic. I'm just about to share the screen with you, so let me know if it's working. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على سيدنا محمد وآل بيته الطيبين الطاهرين وصحبه المنتجبين وعلى جميع الأنبياء والمرسلين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي اللهم عجل لي وليك الفرج واجعلنا من أنصاره وعوانه. Inshallah, first of all, I'd like to highlight a few pointers about the presentation today. The presentation is a broad presentation. As you are aware, I'm in family medicine, and in family medicine, we like to basically explore all aspects of a particular issue. In this particular segment, we're talking about parenting during the pandemic and basically sharing some health and wellness tips. I would like to also begin by praying to Allah subhanahu wa ta'ala for tawfiq to my colleagues, Dr. Hassan and Dr. Zorgami, and their presentations. There will be some overlap, inshallah ta'ala, between the topics. And I hope that during this time that I get the chance to also learn from them along with you as to how we can, inshallah, together work in making the best out of this pandemic experience for everybody. Quick outline for today's presentation: faculties of wellness, inshallah, will be discussed first. Then taking that into context of the impact of the pandemic on parents and children. And then some recommendations and best practices will be basically shared actually alongside, but I put it as a separate point so that inshallah ta'ala we can look up for these. A lot of these are subject to discussion. Some of these are from best available evidence. As you are all well aware, what's available at the end of the day is subject to also looking at from the lens holistically. I am a proponent of holistic, not only medicine, but holistic approach to life. We are all Muslims here, and based on our understanding of life, the religion of Islam is a religion of submission. That is a way of life in many ways. And then inshallah ta'ala, I'll have some concluding remarks. To start off, there are many different definitions to wellness. One definition shared by the World Health Organization is that it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. To the right of that, you see a model of different faculties of wellness, if you will. But as you can see that one of the things that are highlighted here primarily is that of physical, environmental, and other basically issues and faculties relating to this realm. This is not a discussion on deen, but I like to have a more simplified approach, especially when talking to patients. If you have a 10 to 15 minute encounter pre-COVID, now that's down to about 5 minutes at best, as people tend to have, more expectation for quicker resolutions and quicker answers. At the same time, there is the pressure of life that is inherently increasing, which we inshallah ta'ala will take a look at in a second. The four spheres that you see before you do include many of the other models that you see existing. Some of them have 6 faculties, 7 faculties, but in essential, therefore, one that is on the spiritual, the one that is physical, one that is mental, and the other is social. And striking a balance between all four is essentially what's going to allow us to reach that state of quote unquote wellness. Any imbalance in these or any exacerbators of any of them could arguably result in lack of wellness or absence thereof. In terms of the pandemic, one can see it as a stressor under the social realm, in that it is affecting primarily the social setup of society, and then as a result, also impacting all the other four. When I have encountered the patient, for example, especially if it's a mental health patient, we tend to go into this particular paradigm to give an idea for the patient that at the end of the day, it's not only the mental component that you're dealing with. And if I have the chance, I also try my best to achieve that on all other issues that may be faced by patients. But ultimately, an imbalance in one of these essentially causes an imbalance, arguably, in the rest, because they all are dynamic. It's not a static relationship. Now, in terms of studying the pandemic impact, as parents and as proponents of health, we have to understand that the impact is multidimensional. For the purpose of this presentation, I'm going to focus on the impact of the pandemic on parents and take that into consideration in terms of our children, since this is an educational seminar on educating our children in view of the pandemic and its related challenges. Ultimately, our children are our responsibility. I'm grateful to Allah subhanahu wa ta'ala for blessing us with 3 children, Ali, Fatima, Masuma, and Muhammad Hassan, the recent addition to the family. As Rasulullah sallallahu alaihi wasallam says, each of you is a shepherd and each is responsible for their own flock. But that responsibility starts with us, the parents. And both as an educator, as a physician, and primarily as a father and your brother, inshallah. We also have to look at it that our family extends to that of community. So that responsibility is overlapping as well, but it does start at the family unit. So recognizing and acknowledging the challenges, inshallah ta'ala, is, we could say, a halfway point towards resolution and dealing with it in the most constructive fashion. This study is an important survey that was done starting April 14, 2020, describing basically the shift to home-based education during the pandemic and the challenges faced by parents. 4 weeks after nationwide physical distancing guidelines were instituted, that is. The survey included over 400 US adults. Many of them are mothers, 69% to be exact. And these parents were at least a parent of one child that is 12 years or younger. So this would certainly reflect many of you in this population that is currently in this presentation, and inshallah ta'ala for those who may be listening afterwards. The average parental age was 34 years old. The average number of children in each family was 2. And one other interesting factor here is also the population was diversified by the following percentages of races that you see below here. White 71%, Black population 11%, Hispanic 10%, other 8%. I'm basically relaying to you how they divided it. I may not use similar language, but in a nutshell, there is an inherent bias, obviously, with the race included. That said, though, some of the statistics is actually quite interesting. 1 in 4 parents had basically a change in employment, laid off or furloughed. 62% of them had planned to or applied for unemployment insurance, and I can attest to that by the increase in applications for the same. 58% of those utilized free and reduced cost meals for their children had actually lost their access to them. And as you can see, this can impose a big burden to the families in a number of ways. Another important statistic is that 80% of schools had been closed, 96% of the after-school lessons and play dates were canceled. And you can imagine the kind of pressure that can impose on a family when done basically almost on a sudden basis. The graph before you basically highlights the what's called parents' experience of numerous daily schedule disruptions since the coronavirus started. And these disruptions go anywhere from the fact that they have to take on the complete education of their children at home, whether this is online from a school that has switched to online schooling versus homeschooling, or any variations of the above, to lack of physical activity for the parent and the child, to mental health stresses, to basic other changes in day-to-day life, including sleep and other routines. So basically, there's multiple levels of disruptions. And also not in the graph, which is also interesting to note, is that some of these disruptions that were reported, having a child that's too young, our family can attest to that. It becomes more challenging to have a routine, having had an expected routine where children were at school for a part of the day, and now you have to actually take care of all the above all at once. Challenging, but not impossible. And in terms of preparation to educate children at home, many parents felt so the survey actually showed an interesting statistic, which may not be, let's say, reflective of anecdotal experience here, but 55% felt that they're ready to educate their children at home. And I'd like to put in a side note here to show that this perhaps attests to the fitri nature of a father or a mother, that by nature, Allah subhanahu wa ta'ala created us with not only the protective from the imminent danger sense towards our children, but also to be advocates and educators as well. And the beginning of the surah that was recited by our dear brother actually has a beautiful start. Bismillah ar-Rahman ar-Rahim. Ar-Rahman allama al-Quran, khalaqa al-insan, allamahu al-bayan. And as our teachers highlight, the interesting point being brought here is that Allah subhanahu wa ta'ala introduces himself as a teacher before a creator, although arguably the creation of the human being took place before teaching. So this is just a kind of a small, if you can say, emphasis on the role of education in Islam and its importance in the eyes of Allah subhanahu wa ta'ala, so much so that Allah subhanahu wa ta'ala states it first before the statement of creation of humanity. About 50% felt overwhelmed by the responsibility to educate their children at home. And 25% of these parents actually felt that they did not have the necessary resources to educate their children at home, which is not a small number. And obviously this poses a significant and undeniable pressure for both parents as well as their children. I'm going to go back to this graph when it comes to the children, but for the parent from the parental perspective, there is an increase in anxiety since the corona pandemic started. Over 40% of parents reported they felt more nervous, more anxious, or on edge, easily ignored, irritable, have trouble relaxing, worrying too much about things. And this is not something that was happening for only a few days. A number of them, in the order of 30 to 35%, or close to 40, had reported that this is happening for several days as well. So a great number of people are having a mental impact from the coronavirus, starting with the parents and later on, as we can see, inshallah, the children as well. What are the conclusions that we get from this survey? Basically, one, that there are a number of high levels of hardships that are being faced by parents. Many school-age children face hunger as the pandemic persisted, as I may have alluded earlier there, with the lack of access to free meals, specifically lunch and breakfast. And this is actually an important fact to highlight, because this is a private school, to my knowledge. Perhaps the majority of the families enrolled may not be facing this. But we have to also be cognizant that Islam, we believe in the concept of protecting the honor of all families. So there are families that are facing this, and this is a real issue, which inshallah ta'ala will prompt us to further strengthen, and if not there, to actually build a strong social network amongst our communities, starting with our neighbors. And this emphasis starts with Rasulullah sallallahu alaihi wasallam and Bibi Fatima al-Zahra alayhi salam, when she teaches her son Imam al-Hassan that al-jar qabla al-dar. A number of disruptions to daily life is happening to families on a number of levels, as listed here. But one point to take home is that this inevitable pressure is resulting in a number of time-sensitive matters to both the parents as well as the children. In terms of the impact on the children, it's also multidimensional. And this is a brief listing or summary, if you will, of what I believe are some of the multidimensional issues that are being faced by the children, starting with misinformation and misorientation, and this is related to exposure, starting with the parents as to what they say or do in response to the pandemic. The paradigm shift in schooling that has taken place ever since the beginning of the pandemic, the level of physical activity and related sedentary behavior, prolonged sitting and posture fixation. Inshallah ta'ala, I look forward to the lecture on the posture, and we'll allude to it quickly here. Screen time and related health impacts, sleep hygiene, shifting daily routines, and last but not least, mental health. When it comes to misinformation and misorientation that children may be facing, it's important to highlight that although sometimes we may underestimate what our children understand, especially if they are in the younger category, it is important to highlight that during this pandemic, as with any other challenge we may face in life, that we show them the truth of the matter. However, in simple language that the children understand. And this is very important, and perhaps some of the immigrant families, including myself, who lived through, for example, a war such as Gulf War, for instance, and having to live under the rule of a ruthless dictator such as Saddam Hussein, for instance, I'm very appreciative to my parents who were able to teach us at a young age the truth of the matter. But then also teaching, again, in kids' language, the consequence of not following best practices, and inshallah ta'ala we can save the details of that for the Q&A. But the idea is that we don't want to scare kids. At the same time, we don't want to lie to kids, because if they grow and recognize that we have not been able to share with them the truth of the matter, that may highlight to them that it's okay to not say the truth at times, which is not an Islamic tenet. Of course, this is not to be mistaken for taqiyya, which is a totally different topic, but the idea is that this is a good chance for us to demonstrate the importance of truth, especially when it comes to our religion being that of seeking the truth and fulfilling the truth in all its aspects, and a journey to the ultimate truth, Allah subhanahu wa ta'ala. It's important for us to also identify that there's going to be emotions related to this pandemic that the children may want to express. And during these times, if they're having difficulty in expressing them, it is an onus upon us to identify them, and once identified, validate them. One good thing to work on in terms of dealing with the pandemic, especially if the kid is scared, is a focus on the present moment. And although the book I have here is a nice book that talks about Kids Guide to Coronavirus, a guide to coronavirus, and very nice tips actually in terms of how to deal with it and how to bring them to the present moment, it is important to also use this as an opportunity for them to connect to Allah subhanahu wa ta'ala, and having the focus being Allah subhanahu wa ta'ala at all times. So for instance, teaching the kid, for instance, that yes, coronavirus is something that can make you sick, but it starts with putting on a mask, because that's what is the duty for you to do at this time. And at the same time, you also have another spiritual mask that you can put on, and that's where the empowerment of the self, I think, should be first before the children. As they say, put on your oxygen mask before your child or before someone else, in the sense that we have to demonstrate it in our day-to-day life by way of following the advice of our ulama, who gave a very nice prescription to dealing with the pandemic at the very beginning, that after listening to the health authorities, as we all are, to also fall back onto the spiritual masks, if you will, and protective gear, that of Ziyarat Ashura and Hadith al-Kisa. And as a healthcare provider who humbly believes in the faculties of wellness that were shared earlier, this is actually very important, because for us, we believe that our bodies are vehicles for our souls. So really the spiritual protection is, I would say, necessarily first. And obviously the physical comes along with it, because at the end of the day, our bodies are vehicles throughout our journey in this dunya. I will not belabor the point, but the idea is that this, of course, comes with setting up new routines and building new memories for the children, so that the memories of the current restrictions, inshallah, will be positive ones for them as they look back in the future. Educational paradigm shift is another issue that obviously hit everyone's homes to a certain degree. And as you know, it is a major determinant of health, well-being, and socioeconomic outcomes. I included that part not only because it's there in the literature, but because at the end of the day, we have to focus on the idea that we're building a society. And so the social part has to continue, but we just have to take new consideration into play as we make our plans for education for our children. The shift at home is not an easy one. For those who have access to online schooling, such as most of the parents here, definitely I would encourage you to continue to be enrolled in a school that is in your area, with the hopes that inshallah ta'ala at one point things will open up soon, bi'idhnillah, so that children go back to the norm of how things should be. Now, there are pros and cons to online learning. I'm not against online. In fact, my own children are enrolled in a Islamic online school. And prior to this, they had the option of online for people who were not physically in the area. And subhanAllah, with the pandemic panning out the way it did, they then transferred that to basically school-wide. But at the beginning, I have to applaud them for attempting at least to have part-time presence at the school. And this is extremely important. But nonetheless, children are at home now, and there are things we could do now to emulate the school environment, starting with things like setup of the educational platform for the kids, and setup of the courses that they are performing. And if you're already enrolled in a school, a lot of that work is nicely done for you. So you're kind of collaborating now with the teachers and perhaps other parents in ensuring that your children are doing it together. One idea for those of you who may not be enrolled in an online system is to adopt the homeschooling system and maybe partner up with parents. I would advocate for partnering up with 3 to 5 families, so that way at least you can recreate the school environment online for your children. Of course, this does bring out some challenges, with my daughter now going to grade 1. She was very excited with her uniform and everything, but we also moved to a new location, and looking for the necessary supplies that they need, including desks and chairs, may be a challenge. But hey, you use what you have, even if it means you have to share your desk, as you can see my son is doing on the computer. In fact, while I was working on this presentation, he knocks at the door and says, Baba, I need to use a computer. It's time for my Kahoot time. So, this is a great opportunity for them to learn sharing, and at the same time also learn that there is, times on screen and off screen, which we'll touch on inshallah ta'ala later on, and also look forward to in the following presentations. But the idea at the end of the day is that we should work on simulating a classroom environment setting for them at home. And inshallah ta'ala, that could be creatively done by a number of ways, by having, kind of firm start and end times when they start their schooling, by instilling rules and regulations for them to follow. Like, for example, there's lunchtime, that they're free to do whatever they like, but then during class time or study time, there's rules and regulations for them to live by. And this is not very far from what our religion preaches in itself, because at the end of the day, our religion is that of discipline, right? The whole idea of fasting for 30 days is for us to unplug from the day-to-day routines that may detract our focus. But to see that in action is also important for the kids, inshallah ta'ala, during the pandemic, and I can't stress that enough. The other important fact or faculty rather, that is being impacted when it comes to children's schooling at home is the decrease in physical activity that they are having. Some of the statistics are a little bit alarming. So about 90 minutes of school-related sitting is happening at home, and up to 8 hours or more is related sitting per day for leisure activity. This may have been an issue before, but I think it's more of an issue now, and we need to really address that, because that can have a number of physical, as well as, I would argue, social and mental negative impacts. From a physical standpoint, it's a no-brainer. It can cause things as obesity and diabetes and cardiovascular disease down the road. But there had been a rise in the incidence of obesity in children, as young as elementary school, due to the increase in sedentary habits pre-pandemic. So the pandemic coming on and children are actually spending more time at home, this is more of a concern. And so this is time for us to become creative, and this could be as creative as getting them involved with you to do your chores. The following examples are not exhaustive, but are just some examples of things that they could do that are fun, at the same time constructive, that they can see that, oh, you know what, when I do something for home, there is fun associated with it, but at the same time, it's to get them out as much as possible. And of course, while following your guidelines for the city in terms of physical distancing, what have you. Number of activities that can be done outdoors still, while maintaining appropriate distance as best as possible. But also indoors, it's important for us to be creative in terms of what they do indoor, and so that they are not having an idle time that is not constructive. Okay, does all idle time have to be that way? Not necessarily, because after a while, the child himself or herself picks up on the idea that, it's actually more fun that I do something constructive, and that's something I could perhaps play with or share, than just basically sit down and watch TV or what have you. And these can range from crafts to online programmings. This is a picture of Ali and Fatima demonstrating, actually this was a eulogy demonstrating a conversation that would have taken place between Qasim alayhi salam and his mother. But again, just to get them involved and out there. And sometimes you can get a combination of both indoor and outdoor. This is Ali and myself in front of the JCC before we were asked to perform online. We thought we were supposed to do it online at home, but then we later found out that we actually have to be there physically in the building, so that the those commemorating the tragedy of Abu Abdullah have a feel of the center by being in home, but at the same time seeing eulogies and recitations being done at the center. Posture is something that is certainly affected with increased sitting and sedentary lifestyle. There's definitely an impact on dynamic and static structure. Inshallah ta'ala, I'll leave that to my colleague to address that more. But there's a number of health outcomes that can be impacted with poor posture, starting with musculoskeletal system and osteoarthritis, to chronic pain and decreased range of motion, that could basically be a vicious cycle to get out of if not attended to from the beginning. So there's going to be a number of do's and don'ts that I look forward to, and I advocate to myself before you to do, including the posture that I have right now as I present. Increased screen time is in of itself not necessarily a bad thing if regulated. But if not regulated, this is actually a very, very big issue that needs big attention. As I mentioned earlier, I'm not against screen time. However, I am against unregulated screen time. One of the main reasons we enrolled our children in the Islamic school that we have in town is because of the strict prohibition of basically screen time outside of learning. In terms of some of the statistics for screen time prior to the pandemic, there was an average of anywhere between 2.25 to 2.5 hours of screen time for children as young as 8 or younger. And that number rose to more than double post-pandemic. And that's just, doing schoolwork. When it came to including other activities that were being done, that number can rise up to 13 hours or more per day. Some of the evidence do show harm on children from screen time, although some people may disagree with it. But the point that I'd like to highlight is our children are in a developmental phase that is ongoing. The prefrontal cortex, for instance, doesn't complete in its development until the age of 2025. So we don't know the long-term negative impacts that children can have from being exposed to screen time, but there are things we can infer. So some of the things that we have to first look at is, how do children learn? First of all, young children learn by exploring their environment. This is why you'll see them touching things and throwing things and opening the cupboards when they start learning how to crawl and pull things. And they also learn by watching and emulating the adults in their day-to-day life, where there's a reciprocal dynamic relationship, whether it comes to development on a gross motor, fine motor level, or on a language and social level. So these are kind of the four spheres. Excessive screen time may inhibit the children's ability to actually observe and experience life, and may even lead to a type of tunnel vision, if you will. Now, in terms of learning, children do begin learning by the age of 2. So if they're exposed to, let's say, for example, TV or media earlier on in their life, they may be captivated, but they're not learning. If anything, you may be actually causing an inhibition to their potential learning had they not been exposed to TV or to screens in general earlier on in their life. In terms of language development, there's a quick rise in language development between the age of 1.5 and 3 years old. And again, that language is best learned by actually engaging and interacting with adults. So through talking and through play. But early exposure of elementary children to TV or screen in general, I would argue, would lead to poor reading test results, as has been shown by some of the studies, as well as poor attention. Language deficits are expected also as well, given the passive nature of the interaction with screens. And also when you're limiting this reciprocity that is essential to their language and social development, you're again inhibiting a great component of their learning. The American Academy of Pediatrics has some guidelines that one can basically quickly skim as well to basically get an idea of, okay, what is some of the suggested screen time. I would love to go over that in detail with you, to be frank, but I would like to just basically highlight that minimizing screen time in general is important. Children as young as 2 to 5 should not be having exposure to screen time more than an hour a day. And I would argue aim for even 2 to 3 hours max for even children in the elementary school up to 12 years of age, so that there's more focus on other activities in life that they can be done so that they can basically grow more holistically. And when it comes to your preteens and teenage population, you basically want to focus on setting limits, realistic limits, so that they can meet their academic needs and performances through the online exposure. But at the same time, recognizing that online time is part of the time. You have family time, you have dinner time, you have, academic online time, you have perhaps non-academic, I would say even arguably supervised online time. So that way the child recognizes that, as with anything else, it's a tool. It's not something that is necessarily bad in of itself, but if unregulated, for instance, if you give your children excessive food and they become obese, well, of course they're going to develop diabetes. So food in itself is not bad, but unregulated eating habits can be bad. Sleep hygiene is another thing that is impacted, and I kind of linked it to screen time because the two are related in many ways, especially with increased screen use. Normally, when sunset hits,
Dr. Al-Attar, we can't hear you. Is your volume on? Is your sound on? Okay, I think we're having some technical difficulties. We can't hear Dr. Al-Attar. I don't know if he lost connection or anything. Just give one moment, please. Dr. Al-Attar, can you hear us? Okay, I think we're having some technical difficulties. Maybe at this time we should, let me see if I can contact him one more time. Otherwise, I think we might have to move on to our next presenter and see if we can come back to him. Okay, sorry. I think that we're having some technical issues. I apologize for that. At this time, maybe we can move on to our next presenter and then perhaps come back to Dr. Al-Attar at a later time. Thank you for everyone's patience. At this time, I'd like to move on to Dr. Hassan. Dr. Hassan, are you there? Let's see.
Yes, assalamu alaikum.
Hi, Hassan. So we'll move on to your presentation, Dr. Suda Hassan, at this time, and then we'll see if we can come back to Dr. Al-Attar. So Dr. Hassan, let me just introduce her really quickly. She is an optometrist in Los Gatos, California, and has over 8 years of experience in the medical field. She graduated from Illinois College of Optometry Medical School in 2012. Sorry. Welcome, Dr. Hassan. Let me see if I can allow you to share your screen and just take out this one.
I think I'm sharing it. I don't know if anyone can see it.
No, not yet. One second.
Let me stop and do it again. Are you able to see it now?
I'm not sure. Let me see. Yes, now I can see it. Sorry about that.
Okay, no problem. Assalamu alaikum, everyone. Thank you, Rise, for holding this session. And thank you, Dr. Al-Attar. I was really enjoying the very thorough presentation and many important points. As was stated, I'm an optometrist. I'm actually not working currently for the past year after having my second baby, but I'm going to be talking today about vision and ocular health concerns related to screens. As we all know, in the past, probably since March, our children have been on the screen much more than before. And as was just stated, I think 2.5 times more than previous on average. So it's definitely a valid concern, and it's very related to our eyes, seeing as we use our eyes whenever we're viewing the screens. So screen time, what's the big deal? I think we just covered a lot of it in terms of obesity, sleep disorders, anxiety and depression, behavior problems, and addiction, and perhaps more that Dr. Al-Attar will cover once we reconnect. I'm going to cover computer vision syndrome, chronic dry eye, and then the onset and progression of myopia, which is nearsightedness. So in terms of computer vision syndrome, this is where your kid is sitting in front of the screen for, sadly, 6 or 8 or more hours a day now, and they're going to be ending up, and you've probably seen it already, looking like this child looking at the screen. Their eyes are tired, they feel eye strain, they have headaches, their vision is getting blurry, they don't want to do their homework, their eyes are dry. They have neck and shoulder issues, which Dr. Zarghami will cover next, and they might be avoiding near work altogether. They might not be stating these symptoms to you, but if you're watching, you'll definitely see that they're not comfortable. And the same thing happens to us as well. If you're working remote now, or you always are on the screen, you're probably experiencing some of these symptoms. So the things that we'll talk about can be applied for our children and for ourselves, inshallah. So we'll get to the bread and butter right away, the tips to avoid eye fatigue. You want to start with how you're setting your child up for their workstation. Ideally, you want to have natural light. So if you can place their workstation close to a window or door, getting as much natural light as possible, that would be best. If not, you want to place enough lighting in the room to where the lighting is matching the screen brightness. So if they like their screen pretty bright, you want the room to be pretty bright as well. If they're more of like a medium screen, then you want the room to be medium. You never want the screen to be a lot brighter than the room or the screen to be a lot dimmer than the room. This will cause more eye fatigue if you're doing that. And then if they're in glasses, I highly recommend that we make sure they have anti-reflective coating on their glasses. This will cut down on the glare that's coming off of the screen so that they're not trying to look through that glare when they're trying to focus on what they're learning. That can be placed on any glasses, and I highly recommend it for everyone. And then in terms of posture, we're going to want their feet flat on the floor, the screen slightly below their eye level. So ideally, you don't want them looking up at their screen. So if you can somehow manage to adjust their chair, if they're younger, adjust their chair to be a little higher and their screen a little lower, that way they are looking down. And the reason for that in terms of the eyes is when we're looking a little bit slightly lower than eye level, less of our eye is exposed, and so our eyes do not dry out as much. If you're looking up, more of your eye is exposed, and then you're going to be experiencing more dryness, which is something else that we'll talk about. You also want the screen about what we call Harmon's distance away, which is at least like a bent arm's length away. Or for little kids, it's the distance between their wrist and their elbow. So if they're holding an iPad, which I hope they're not doing too much, but if they are, you want it to be about wrist to elbow length away from them at all times. Same thing for a book, same thing when they're coloring, same thing when they're doing any arts and crafts. You always want to have at least that arm's length distance away so that they're not creating more of a focusing demand than is required. If possible, in terms of our virtual learning situation, it would be great to be able to project whatever they're viewing in terms of if maybe it's a live session with their teacher, or maybe it's a video that they need to watch for school. If you're able to project it onto a TV, that's better for their eyes because that's a further viewing distance and it requires less focusing demand anytime we're looking far away. Anytime that we're looking arm's length or closer, our eyes actually have to focus in order to make that clear, and that can become tiring after hours of such work. And that brings me into the 2022 rule, which is where you want every 20 minutes to look 20 feet away for at least 2 minutes. And the reason for that is, like we said, whenever you're looking up close, you're having to focus your eyes. And when we're focusing our eyes, we're actually using muscles in our eyes to maintain that focus. So if you're looking at a book or you're looking at a screen, in this case, you're focusing and your muscles are working in order to maintain that focus. And just like if you were lifting something, even if it's a light object, if you lift it for about 20 minutes, you might be okay. If you're holding it for about an hour, that arm's going to get tired. Same thing with the muscles in the eye. So every 20 minutes or so, you want to look far away, have your children look far away, blink a few times, focus on something far, and then look back. So with kids, the best way to do this is to set an alarm on their device or on something next to them, where it goes off every 20 to 30 minutes, and that reminds them to look away. If they're sitting next to a window or door, they can look out the window or door, and that gives you a nice distance for them to view. If they're not, you can post something on the wall opposite to them or in the hallway or wherever they'll be able to look from their seat, and have them look at that. Ideally, you want something that they can focus on, so not a plain white background. You want either a picture or maybe a positive phrase or an ayat from Quran or something that they can look at and actually focus on in order to relax the focusing system and give them a break. If they can get up and run around or walk around or go get a drink of water or take a snack break, even better. The key with virtual learning is taking a lot of breaks. And I'm not sure how RISE sets up the school schedule, but if we can build in some breaks, it'll make a big difference for children. And then of course, none of this will help if we are not giving our children the best vision possible to work with. And so for that, I highly recommend getting an eye exam if you haven't in the past year or two for your child, and making sure that they're working with the best possible vision, meaning if they have any sort of uncorrected refractive error like nearsightedness or farsightedness, we want to make sure they're in those glasses when they're learning and whenever recommended by their doctor, as well as if they have any binocular vision conditions. This is where whenever we're looking at something, especially up close, our eyes need to be working together in order to do that. You need both eyes focusing on the same object and accommodating equally so that you get a clear image, and your brain needs to be able to put those two images together. Some children will have trouble with that, whether it's an eye muscle issue or if it's a processing issue. But either way, it can be uncovered at an eye exam, and it'll make them a lot more comfortable and more successful, inshallah. So I highly recommend that. And we can do questions later, because I know I went through a lot pretty quick there. But the other issue that we have with a lot of screen time is dry eyes. And you might be experiencing this yourself, and you may have had some complaints of your child. They might not be calling it dry eyes, but you might see them rubbing their eyes a lot, or they might just say that their eyes hurt or they're tired. Sometimes it's described as like a sandy feeling inside of the eyes. These are all signs that the eyes are dry. So in order to have healthy eye structure, we need a smooth tear layer on the front of the eye surface. The very front of the eye, in front of the colored part of the eye, is the cornea. That is the clear layer that bends light as it enters into our eye and then sends it through, and it continues on from there. If we don't have a clear cornea at the front surface, or if we don't have a smooth tear layer on top of that cornea, then our vision becomes spotty and our eyes become uncomfortable, dry, irritated, red, and the list goes on. So that can happen from a lot of things. It can be environmental. It can be because it's winter and we have the heat on and our heat is drying the house out. It can be because of what we're eating too many foods that don't have enough omega-3 and too much fatty food and processed food. All of that will have an impact. It can also be from screen time or from medications. And most of the time it's from all of the above. So the issue is that we're noticing with children that they're having more dry eye than before. And so the question is it related to their screen time? Probably it's at least part of that. So the picture on the right, the black and white pictures that you see, the top picture is showing us what healthy meibomian glands look like. These are the glands inside of the eyelid that release oil onto the tears. And the oil is responsible for maintaining our tears so that the tears don't evaporate. When our tears evaporate, our eyes will become dry. So you want healthy meibomian glands, you want smooth oil coming out of them, you want it coming out every single time we blink, and then the eyelid spreads it over the eye. In the top picture, these are healthy, beautiful meibomian glands. They look great. In the middle picture, you can see that you're starting to lose some of that oil in the glands. Some of the glands are shorter, they're becoming truncated, and that's a sign of future dry eye. And then the last picture is pretty severe loss of meibomian glands. And the most troubling thing here is that we can't regain as of now, we can't regain meibomian glands that have been lost. We can't create more healthy glands. We have to use what we have and try to maintain it. So with our children being on screens and us being on screens so much, we want to make sure that we're implementing some habits that can help maintain those glands so that when we're 50 or they're 50, we're not dealing with that third picture there, and maybe even sooner. So things that you want to do will be on the next slide. So in order to prevent some of that dryness, we want to make sure our kids are getting enough sleep. When our eyes are closed, they're able to regenerate a little bit and rehydrate fully. So we want to make sure they're sleeping. Some children will sleep without closing their eyelid completely. If you have a kid that does this, you've probably noticed that it kind of looks like they're awake and you look closely and they're asleep, but there's just a little gap between their two lids. If you have noticed this with your child, I highly recommend doing a gel eye drop. That would be a pretty thick eye drop or an ointment eye drop right before bed to try to give them a little bit of moisture to hold them over till the morning. And then you can also consider, you can discuss with your eye doctor, but we could tape the eyelids at night as well. But make sure they're getting enough sleep as a baseline for everyone. And then you also want to avoid having their workstation be set up in the line of the heat or the AC. So you don't want them too close to a vent that's pointing at them or at their workstation. You want to limit continuous screen time. And so right now it's hard to do, but even if you're able to just alternate between digital and print material. So if your child is needing to do some things on the computer and hopefully some things on paper, try to set up their schedule where they're doing, 30 minutes of the screen and then 30 minutes of paperwork and then going and doing an activity and coming back to do the screen again and repeat the cycle again. You want to break it up as much as possible. Doing 1 hour of screen time consecutively versus doing 20 minutes 3 times makes a big difference in terms of our eyes and likely our comfort in other ways too. You could also start blinking exercises. So perhaps as they're doing their 20-22 rule, every 20 minutes, looking 20 feet away for 2 minutes, maybe in those 2 minutes, they can be doing some blinking exercises. So like I said, every time we blink, our eyelids release some oil onto the front of the tears. So we want to do some nice hard blinks, not really quick blinks. You want to close the eyes, press, open, close, press, open. This will release oil onto the tears. And if you try it right now, hopefully you'll feel a little bit of oil or something cold on your eye, and that's the oil releasing from your glands. If you don't feel that, you're either not blinking hard enough or you already have some issues with your meibomian glands that you can try to address. The other thing we want to do is make sure they're getting enough omega-3 in our diets. That can be from salmon and other kinds of nuts. So we want to make sure we're doing that and reducing other types of foods that would hinder that. Anything that reduces inflammation would be good. If we're already experiencing dry eye, some treatment things that we can do would be hot compresses. This is where you can take one of those beady little eye masks and you place it in the microwave. Let it get nice and hot, but not too hot. Close your eyes, rest on your eyes for a few minutes, 5 to 10 minutes. It needs at least 3 minutes just to get to the glands, for the heat to get to the glands. So that's why we say 5 to 10 minutes, because if we say 10, you might get 7. If we say 5, you might get 3. So shoot for 5 to 10 minutes every single day. It's nice to do right before bed. It might help with falling asleep or whatever time that you or your child can work it into your schedule. With this, consistency is key. So we want to make sure that we're doing this regularly. You should notice an improvement. When patients complain of dry eye, this is the first thing we start with because it's more of a preventative and it's you working with what you have instead of putting something in something synthetic. So hot eye compresses, if you don't have a microwave, they also have some that you can plug in to the wall or to USB even, I've seen, and it'll warm it up for you. And then you do the same thing, close your eyes and rest on your eyes for a few minutes. And you can even press a little bit so that it gets into the glands, the heat gets into the glands. We can also start artificial tears. Artificial tears are just an eye drop that re-wets the surface of the eye. There's no medication in it, so it's not harmful. You want to make sure you're getting a good quality one, though. You don't want to use anything that says get the red out. Those typically just focus on making your blood vessels smaller, which is not what we're trying to do. We're trying to increase moisture in the eyes. So we can do an artificial tear for us and our kids in the morning before they start their schoolwork, maybe at lunchtime and once before bed, or just morning in bed, whatever you feel is necessary. And that should help a little bit. And as I take a break to take a sip of water, we want to make sure we're also increasing our water intake. Our tears use water in order to be formed, so we want to make sure we're getting enough water in our bodies to maintain moisture. The other thing would be reducing caffeine. Hopefully it's not an issue for our kids, but for ourselves, make sure we're cutting back. For every cup of coffee you want to have 2 cups of water to make up for it. And if you can cut back on the coffee and tea, that's even better. If you do all of this and you're still having trouble with dryness, you definitely want to see someone and can get a more tailored approach with prescribed eye drops if needed. And there's also eyelid treatments that can be done. So the next thing we're going to talk about is the myopia boom. Myopia is nearsightedness. Globally, there's an increase in the amount of myopia, or the number of people that have myopia, and it's trending up, as you can see on the graph. The light blue bars are general myopia, so that's like your -1, -2, -3 of nearsightedness. Anyone with glasses in minus, we call that myopia. And it's increasing quite rapidly, and it's expected to continue to increase. And the dark blue bars are what we call high myopia or progressive myopia. This is where the nearsightedness is continuing to increase at an abnormal or an increased rate. And it continues to increase beyond our typical myopia. So normal myopia usually will level off in our late teens, early 20s. Whereas progressive myopia will continue to increase. And that's where you'll see people with -20, -26, -32, even -18. You know, this is all concerning because, as you can see, the bulleted points here, progressive myopia means that our eye is elongating. And as our eye elongates, that creates some risk for retinal detachment, which can be detrimental to vision. That's where the last layer, the internal last layer of the eye, peels off and can cause vision loss. And it can also, the elongation in the eye can cause early onset of cataracts, which is a cloudiness of the natural lens inside of the eye. It can also cause glaucoma, which is an eye disease that takes away side vision. It can cause macular degeneration, which is an eye disease that takes away central vision. So globally, nearsightedness or progressive myopia is the second most common cause of blindness, which is concerning. And that's why there's a lot of attention now, a lot of research going on to find out, why is there so much myopia? What can we do about it? How do we slow it down? How do we stop it? Once it's started, how do we try to slow down the increase? So, whoops. So the research has shown that the biggest factor of onset of myopia or the progression of myopia is how much time a person spends outside. So this ties in really well with what Dr. Al-Attar was just speaking about. And the reason why this ties into our screen time talk is, if screen time is replacing outdoor time, then this is a big issue. And it likely is. Most of the time when kids are doing their screen time, they're usually inside. So they did a lot of research on children in different parts of the world. They focused in the 2018 study on Australia and Singapore, because Australia has a very low incidence of myopia or prevalence of myopia, and Singapore has a high. And they found, and some of you might be saying, oh, well, they're Asian in Singapore and Asians are always nearsighted, which is true, but is often true. But they also compared Chinese children in Singapore versus Chinese children in Sydney. So they took out the whole genetics factor and still found that in Singapore, 29% of the children were myopic, whereas in Sydney it was only 3%. Talking about a big difference here. What they found is that the Australian kids had more screen time, but they were also outside 2 to 4 times longer. And so the conclusion there with their data is that the more time we spend outside, the less likely we are to increase our myopia. And if it's when we're younger, it will delay the onset of myopia, which is a big deal. So for children up to 3 years of age, which is similar to the data that Dr. Al-Attar was showing, for children up to 3 years of age, their eyes are still rapidly developing. Everything is changing. Their eyes are growing. We need daylight exposure in order for our eyes to develop normally. It's related to the amount of dopamine that reaches the retina, and that's what tells the eye how much to grow. So if you have young kids at home, make sure they're spending as much time as possible outside. And even if your children are older, you also want to have them spending lots of time outside so that their nearsightedness, if they already are nearsighted, will not progress as much, ideally. So I highly encourage, I know we're in a pandemic, we're not going outside as much. The school is online 6 to 8 hours a day. Try to build in breaks, depending on what your setup is at home. If they can have lunch outside, if they can have reading time outside, if they can run outside and play when they have breaks. If you can build in a break before Maghrib, I know the sun goes down early, so that's a challenge right now. In the morning, whenever you can get it in, bundle them up if it's cold, take them outside, do some of the activities that were shared earlier. Just spending time outside can have a big effect on them, inshallah. And that's my little boy climbing a hill. So if your child is already myopic and you're a little concerned, if they're nearsighted and you're concerned, there are some things that we can do in terms of trying to slow down the progression of myopia, and it's actually quite successful. So if your child's nearsightedness and myopia has increased more than a diopter within a year, that's when we start to say, okay, this is changing too much. Do we need to start slowing it down so that we can avoid some of those negative effects that we talked about in the last slide? So there's options like we can put prism in the glasses, we can do bifocal glasses that'll reduce the focusing demand up close. We can do special soft contacts that have a multifocal built into them. We can do overnight glasses that will reshape the front of the cornea throughout the day to slow the progression as well. And we can do prescription eye drops once before bed to control it as well. So if you're concerned about that, you can speak to your eye doctor, or feel free to email me if you just want some input or some more detailed input based on your child's findings. But definitely something to pay attention to and not to ignore, inshallah. So what about blue light? This is like top question for screen time concerns. Blue light in terms of screen times, yes, screens give off blue light, so does the sun. Everything that we use gives it off. When we're looking in front of the screen for a long time, in terms of eye health, the studies don't show any solid proof that it causes any damage to the actual structures of the eye. So that is not as much of a concern currently as what it does with our sleep cycle. And that will affect some people more than others. So if you or your child feels affected by this because of all the screen time, then you can consider having a filter put on your glasses that blocks the blue light or reduces the blue light that's coming into the eye to help with things like fatigue and sleep disruption. It's not something that I recommend for every single person though, only if you're symptomatic. So as a recap, tips to avoid eye fatigue: address the lighting and glare in the room, work on the posture, which Dr. Zarghami will cover for us in detail, and I need to apply. And then the 20-22 rule: every 20 minutes, look 20 feet away for 2 minutes, ideally looking at an object or out a window. And project onto a TV when possible. Address treatable vision conditions with an eye exam. Make sure they're working with the best vision possible. I believe that's all I have for today, but we'll do questions afterwards. Inshallah, we can all make the best of the situation.
Okay, thank you, Dr. Hassan. That was very helpful, and I've fixed my posture already a little bit, I think. But we'll hear more about that from our next presenter, Dr. Reza Zarghami. Dr. Zarghami is an experienced chiropractor with a demonstrated history of working in the medical practice industry. He earned his Doctor of Chiropractic degree from Palmer College of Chiropractic West, and he currently practices in Mayview Community Health Center in the Bay Area. So welcome, Dr. Zarghami.
Assalamu alaikum. Bismillahir Rahmanir Rahim. Thank you, both Dr. Hassan and Dr. Attar. We're gonna try and keep it as short as we can. I know we're running short on time, so between that 10-15 minutes, and I will try as much as I can not to repeat the same thing that was already mentioned by our dear panelists. So let me try and share my screen, and then we'll go from there. Just let me know, Sister Mahmoud, when the screen is up.
Yes, we can see it. Thank you.
Okay, good, great. So we'll just start off with a little bit of simple spinal anatomy so that we can understand better regarding everything that's we're going to start. Afterwards, we're going to talk a little about spinal health, what we're doing wrong, obviously how we can make corrections so things don't repeat itself, and then a little bit of preventative care we can do. Unfortunately, what we're used to is when pain comes on, let's go see the doctor. We're trying to change that mentality by before pain comes on, let's take care of it so later on we don't have as many issues going on. Going a little bit into the spinal anatomy, since we're going to talk a little more in terms of that. 3 different curvatures within the spine, figure A as you can look. So cervical spine would be kind of your neck area. Thoracic spine is the middle upper back area where it's kind of between your shoulder blades. Going down to that lower back area would be obviously your lumbar spine. Most of the issues come from us not doing well for the lumbar spine and everything else that stacks on top of that lumbar spine getting aggravated. Imagining that lumbar spine on the bottom being the first building block for our lower back and everything else sitting on top of that. Obviously, when we have a little bit of misalignment within that lumbar spine, you would see the most deviation at the very top in your neck. So correction within the lower back can definitely help the rest of the body as well. In general, what we see within the spine in figure B is kind of what we call scoliosis. Any form of deviation within the spine. You can have a lateral deviation, you can have a rotational scoliosis. Either of the two can cause issues. Before schools were doing spinal screening, unfortunately right now, especially with the schools being closed, they might just not have anyone come to do the screening for them. So we kind of ask the parents to do it, basically just taking the shirt off for the kids, have them bent straight down 90 degrees, look at the middle of their back straight down and see if there are any deviations within those pointy building blocks on their back. If you do see that, obviously it's advisable to go see their medical doctor, speak with an osteopath, with an orthopedic doctor, with a chiropractor. So there are many options for the parents to treat their patient, their kids in general, especially daughters, because in scoliosis cases, girls tend to have a little bit of a higher progression within that curve. And the deviation goes higher, and it's more common in girls as well. So definitely for parents to keep looking at that, that would be very important. Kyphosis, the very last figure C on the right side, just ends up coming from bad posture and not sitting correctly, not having the support we need within that lumbar spine. Looking a little bit more at the older generation, like now, looking at the grandparents, we see that posture more common where their shoulders are a little more rounded, there's a bigger hump in the back, and they have lost a little bit of their height due to that poor posture, unfortunately, which we're going to try and talk about so we can avoid that as much as possible. Going on to the next slide. So these are all the poor postures we usually see. Kids are sitting on the floor, they might be moving around, they have all their objects around them because now they're not in a school with a backpack with a desk. So their posture obviously is not the best. Sitting on the floor with the laptop, leaning against something. Sitting with their foot under themselves, obviously one of the worst positions. You're rotating your hip, you're trying to sit correctly, you get tired after a little, you try to move and correct that posture by putting your feet down now, crossing your feet. So all those, unfortunately, are the main concerns we have with wrong postures that aggravate and give us musculoskeletal pain, as Dr. Attar was talking about. In general, what we want to do is to sit straight and with our back fully supported with a desk. The picture with a person sitting on the desk, it's good. They're using a desk, there's a chair, there's a monitor, keyboard is separated from the monitor, but there's no support whatsoever. So those are things that we gotta be really concerned about. The head looking down. Usually the head itself just weighs about 10 to 15 pounds. The further we look down, the more that angle of degrees goes forward, the more pressure is built up. So as the figure says, 60 degrees down, head looking, we're going to have about 60 pounds of weight holding down with that neck. So the neck is not strong enough to hold down 60 pounds of weight. Imagine holding on to a bowling ball and trying to hold it out straight. That will try to decrease the strength that you're going to be able to have to hold it up. Anything over 10 seconds, you're going to be fatigued. So that's the amount of pressure that's being put on your neck every time you're looking down on your phone or your tablet or even the laptop, trying to do whatever work you have to do. The main reason we have that brace right in the center of the image is, unfortunately, recently everyone, the home care they've been going to is, oh, let's wear a brace. It keeps us nice and straight. The issue with the brace is that it actually weakens your muscles. So it causes atrophy in your muscles, and your muscles shrink and get really tight. When you take that brace off, you go back to the same position you originally were. You have a rounded shoulder, you're having a little bit of a kyphosis, bending forward and having no support. So just trying to avoid that is the best option. The reason being, when you wear the brace, your brain sends a signal to your muscles thinking that there's no more energy to be needed to keep those muscles healthy. So it doesn't send the energy there, it sends it to the rest of your body, and those muscles just tend to shrink and cause more pain later on down the road. Little bit more verbology to be talking about the bad habits that we have. So what happens is what we call anterior head carriage. When we're sitting in a bad position on the couch, on the floor, on the bed, what happens is our head tries to compensate by trying to look straight down. So what happens is your chin would be jutting out, unfortunately, which is one of the worst positions because it aggravates the muscle in front of your throat. So right around the trachea, those muscles get really tight. And if you try and right now reach for those muscles around your throat and actually try to touch them, they feel very tender. That's from the bad posture we've been having by looking straight. Kids, as Dr. Hassan also talked about, because of the limited screen time, as they're looking at it, when they get tired, they try to bring their head even closer to the screen just to be able to focus more. And doing that position even aggravates those muscles. So because of the anterior head carriage, we get more of that kyphosis that we talked about. When there's no lumbar support, what will happen is that you're trying to bend your shoulders down just to relax your muscles. What's happening is, unfortunately, those muscles are getting hyperextended. So we're pulling them a little extra on those muscles. They become loose. Later on, when we try to sit nice and straight up, your muscles just get tired because they're not strong enough. You've been just pulling them too much. Now you're not able to get those muscles nice and sturdy to keep you straight up. Again, coming back to the concept of shoulders being rounded, which goes hand in hand with the kyphosis. So what happens is your shoulders, when they come forward, they add even more pressure to the front, to the chest. So those muscles in your chest actually get tight. You have a harder time actually breathing. So it even elevates your blood pressure. These concepts apply to both the kids sitting at home doing their work and also to the parents and the grandparents. Poor posture in general is something that has a very vast majority of people having issues with it. Musculoskeletal pain comes from anything, any part of the body being in a malposition, so in a wrong posture that it shouldn't be. But overall, what you want to do is you want to increase what we call lordosis within that lumbar spine. Lordosis is having a little bit of a more curvature in the lumbar spine. Back in the day, they used to say, yeah, you have a higher lordosis in your spine. This is not good for you. Unfortunately, nowadays, since we're more sitting, we're more sedentary due to our work and our schooling, actually having a higher lordosis would be helpful. Thinking of the first slide that we talked about, lordosis would be the actual curvature where your stomach is actually coming out a little more. And that would be more helpful of what we want in terms of sitting straight. Few corrections. Again, some of the panelists talked about them, but we're just going to lightly speak about what we want to have. Looking at the picture on the top left, so when we're sitting behind a desk, your back has to be flush with the chair. If your back is not flush with the chair, there is no muscular support for your back. You're sitting straight without a support, your back gets tired after 10-15 minutes because you're more focused on the amount of work that you're doing, be it your schoolwork or your actual work for your job, and you tend to shrug your shoulders down even more and lean more towards the screen. So having that support is very important. The height of the chair compared to the desk is also very important. Unfortunately, if the kids are using the same desk as the parents are using, it will not be helpful because the height of the desk is higher, the height of the chair is higher. You could try and elevate the height of the chair so it matches the desk, but then the issue would be that the feet are dangling off. So kids try to compensate with that by putting their foot under them or try to kind of sit cross-legged. Those are all positions that aggravate our back even more, puts more strain on the muscles in the back. So correct position, what would it be? Have your back being flush with the chair, your hip being a bit higher than your knees. So looking at the picture, the angle of the hips are a little bit over 90 degrees. The knees are a bit lower, takes the pressure from the lower back, now spreading it out to the rest of the legs. And as the foot comes down to the floor, you need a little bit of footrest, elevating your feet to a certain point so your feet are not just dangling off the floor and not touching anything. That extra support spreads the weight out into the floor and takes it off from your so joints. That would be your ankle and your knees, making them a little bit less strained. Hands have to be a little bit flat on the table, but you want your elbows to be slightly higher than your wrist. Very important. If your elbows are actually lower than your wrist, you tend to later on get what we call carpal tunnel. Very common, because you're having your hand in more of a flexion mode where your fingers are getting closer to your forearm instead of it being away and extended further out. Very, very important to have that position as well. Not trying to go too much regarding position of the screen since Dr. Hassan talked about it, but again, you want it to be always looking at the top part of the screen, even with a little bit of head down. If you're in any other position further way too far down or too far up, that aggravates your neck, puts strain on the shoulders, which you get pain within that area. Sometimes if it gets more severe, kids even mention when they're holding onto their phone, they feel some tingling running down their hands or a tingling, numbing sensation running down their fingers. And that's all from the pressure that's getting built up within their neck. A kid that's 10 years old coming to the clinic, we had one a couple days ago, they had numbness down their hands. Usually you only see that in someone who's over 60 years old because they've been just abusing their body and have been working so much and their muscles are now getting weakened. They have degeneration within their spine. You should not be able to see that within a 10-year-old. It was just so sad to see kids at this age now coming to clinic because of any form of back pain or shoulder pain or even just numbness within their hands and legs, unfortunately. Positional changes, very important. If you're sitting for anything over an hour, you want the kids to stand up, walk around a little bit, try to lubricate that spine. When you're sitting and not moving, your spine is getting crushed by the force of gravity and the position that you're having it through because you're focusing on your work, you're not paying attention to the posture that you're having, unfortunately. So those really are devastating and aggravating for the spine. You want to walk around for about a minute. We don't expect anyone to go outside and start running for 20 minutes. You get up, walk around for about a minute, just move around, rotate your shoulders a little bit, and then sit back down, continue doing your work. You can change your position every 30 minutes from sitting to standing, like the picture shows. Try to work while you're standing so you don't have to take away from your work and lose that focus. Continue doing it, just try to do it standing. There's a lot of sit-to-stand desks that patients or parents can purchase for their kids, and it really does help. It really takes away from the pressure. Sometimes the sit-to-stand desks are actually within the same desk. You just pull it up and then move it down. You don't have to use actually two different desks. They've been very common. Prices are actually very good too. I was looking the other day, different categories of them. So I'm pretty sure everyone can afford them. It's worth more than the money you will be investing later on to take care of the kids and taking them to the doctor. So sitting only on a chair. You don't want to sit on your bed. You don't want to sit on the floor. You don't want to be sitting on the couch doing your work. Those positions are what causes our issues from later on. When you're working, just sit behind a desk, have the proper environment, as Dr. Attar said. Just make sure you put your kids in a room with a desk and a chair that's proper for their schoolwork. When they're done, leave that room. Kind of like when they get recess. Now they're not getting that. Unfortunately, they're behind that screen. And when they're done on their break, now they're on their phone again, getting that eye strain, unfortunately. So they need to have the time to run around, move, be at that exercise that they need so that their pain reduces, the pressure goes away. So when they sit back down to continue doing their work, they're actually able to focus for the next class and not have pain within any of the shoulders, lower back area. Talking about sleeping. Unfortunately, now with schoolwork going on too, kids tend to kind of fall asleep everywhere. Even my kids, they don't even go to school, but it's just they're in the house so much, they're not able to go anywhere, so they sleep on the floor. Sometimes I see my son just crash on the corner of the house, and I have to go pick him up, put him in his bed, or they're falling asleep on the sofa, on the couch. Best place to sleep, obviously, it's on your bed. So you want to sleep on a mattress that is firm. If it's too soft, or if you've been using it for too long, obviously the mattress doesn't have as much of a support as it should. Sometimes you look at the mattress, you look at it, you see like as if there was a ghost already sleeping in there. There are so many divots within the mattress since it's been used for 15 years. It's been passed down from siblings to siblings. That definitely aggravates your pain. One of the symptoms is you sleep at night, wake up in the morning with pain. You didn't do anything. Obviously, the reason that you got your pain was because you were sleeping in a bed that did not have enough of support. So make sure your mattress is between anything from firm to medium firm. Do not use any mattress that's soft, because that will not give you enough of a support and release when you're sleeping at night to take the pressure off your lower back, upper back, or your neck. Only 2 sleeping positions. Putting aside the religious aspects of not sleeping on your stomach, scientifically, it is definitely the worst position to sleep at. So if you sleep on your stomach, your neck is going to be rotated to one side or another, unless you can fully put your face in the pillow, which I doubt, because nobody will be able to breathe that way. And your neck is rotated to one way or another. At the same time, you're reversing that curvature within your lower back, which is what we're trying to avoid, and it will aggravate your pain. So try to sleep on your back, use a pillow under your knees. At the same time, you're going to use a pillow for your neck, but you're going to use a pillow that has a little bit less of a height than the pillow you will use while you're sleeping on your side. The reason being, the distance from the back of your head to the back of your shoulders is very little compared to the distance from your ear to the shoulders. I'll repeat that again. The distance from the back of your head to the back of your shoulders is much less than the distance from your ear to your shoulder. So when you're sleeping on your side, you need a bigger pillow to support your neck nice and straight. Because if you're using a bigger pillow, your head is getting tilted up, aggravating the muscles on one side by pulling too much on it, not having your spine straight. Now, as if you're looking at a little bit of an angle vision, then if you look at yourself, you'll see that, oh, the pillow is too much. Sometimes people put their hands under the pillow. Obviously, that aggravates the hand, also aggravates your neck, because now you're adding more height to that pillow. Sleeping on your back, very, very thin pillow. You only need a little bit of support. And the reason you actually use the pillow is for your neck. You're not really using it for any support for your head. Your head doesn't need any support, because it will already be touching the mattress. The part of the body that will not be fully touching the mattress is the neck. So what you want to do is you want to take a towel, roll the towel, put it under your neck. That way you don't even need to use a pillow. Everyone's different. You just got to try and mix and match for that. Again, kids can definitely do that too, because of everything going on now. All these concepts both apply to the adults and the kids, and those have to be corrected. Because if they're not sleeping in the correct position, they're not going to wake up feeling like they want to do anything around the house. Those are very important. Going on to the next slide, we don't want to go too detailed on them. We talked about positional changes, obviously. Other than that, some exercises, which we're going to have, I have an exercise sheet that I'm going to email out, and I'm going to have that sent out because there's too much details on it. And probably it will be hard if we just go over them right now. Nobody will remember. I'll send that out, and I'll have the school send it out to the parents so they can do that with the kids. But in general, having a foam roll, as you can see in the picture, can really, really help reduce the stress within the back, anywhere from the lower back to the shoulders. If you don't have that, take 2 tennis balls, put in a sock, tie it up. There you go, bam, you have a foam roller. You could use that within anywhere of your back to take that pressure away, kind of doing the self-massage. So what you'll do is kind of rub it around the back, up and down, try to release the pressure that you're feeling. Because in general, when we're sitting too much behind a desk, that happens no matter what. Since we're not able to go outside to the gym, not do a lot of exercises, you can use that for your neck as well, right? So you're just going to kind of rub it up and down that spine, releasing the pressure from those muscles that are around the curvature of the spine. Again, not going too much detail about the sit to stand because we talked about it, but constant positional changes is very important. Little bit of specific treatments that we do. So we're at a nonprofit clinic. We do accept Medi-Cal patients who have Medi-Cal. So please, if you feel like there's any specific issues, come by, inshallah, we can take care of it. Obviously, very careful with everything going on because of the pandemic. So everybody's wearing PPE or protective personal equipment so that it does not cause any spread of the virus. So many people don't know about this, unfortunately, but their insurance has high coverage for chiropractic care. It was not as much before, now it's actually higher. So if you look and speak with your insurance, they'll tell you how much your copay is. Usually it's much cheaper than how it was before. It's around $20 per visit. It can really help even for the kids. I personally adjust my kids. My daughter's 3 years old. My son's 2 years old. I actually adjust them. That's not what you might think or what you've heard or what you've seen on YouTube. It's much, much less aggressive than what you see, but it will definitely be helpful. If you don't have insurance, there are actually some franchises out there, and I'll work for them as well before. They can really help as well. The price, again, same thing around that $20 range, can really help the kids and yourself too. So just take advantage of it. If the information is needed, again, we'll have the school handouts information out so you can get that taken care of. And that's it. I was just making it really short and quick. I guess we'll go to Q&A after this if everyone's ready. If not, then we'll see what the program is.
Okay. Thank you, Dr. Zarghami. I have already adjusted my position. Thank you again to Dr. Al-Attar, Dr. Hassan, and Dr. Zarghami for your presentations. I'm sure everyone has found them very useful and very helpful. Next, I'd like to just quickly take a moment to say a few words about our sponsors. This event is sponsored by Rise Academy, Rise Education System 501c3 nonprofit organization. Our goal is to create a global community of learners. We have Rise Academy, a face-to-face school in San Jose, California, and Rise Online nationwide in North America with the aim to go global. We at Rise Education System hope to continue presenting seminars on topics that impact our youth. Please follow us on our YouTube channel to stay connected and receive updates. We will be posting a link to a survey in the Zoom chat and the description of the videos on YouTube. Please actively participate in the survey so we can plan further seminars based on your needs. At this point, we will open up for a brief Q&A. You can chat your question in the Zoom or YouTube as both platforms are open, and we will take questions only related to the seminar topic. So let me read the first question, and whoever would like to take that. Our first question is from a Rise Online. For a Rise Online student, how much exercise is needed for a 15-year-old girl and a 13-year-old boy? So I'm not sure who would like to take that question. But actually, Dr. Al-Attar, I know that we lost you in the middle. Would you like to take the question on and then we can hear from you again?
Assalamu alaikum. I think there's an issue with my voice. So in terms of the audio, I think it's going on and off for some reason. I think that's what happened earlier in the presentation as well. So if it happens again, somehow you can unmute me, that'd be great. So if I understood the question correctly, what is the general advice for a 13 and a 15-year-old female and male respectively, or vice versa? It's a very broad question, but at the same time, a good question. Staying active right now in the pandemic, as was inferred, is difficult, but it's not impossible. Generally speaking, the general advice for younger population, because you have not reached your full maturity in terms of a skeletal system, as well as your musculoskeletal in general, it would be advised to avoid weightlifting and do more cardiovascular type activity. In terms of minutes to hours per day, there's variable recommendations. But at least I would say a total of 2 hours of physical activity a day is minimum. So when I say minimum, I'm highlighting that in bold, underline and capital letters, because as with other children, you learn by doing things, and being in the outdoors is actually very important. Not just outdoors, but just doing activities is very important. But when it comes to exercise, your cardiovascular health is dependent on your movement in general. And a habit that is established later in your teens is likely to carry through the university, and that is likely to carry through the rest of your life. That's my humble 2 cents on that. There's more to this, but that'll be kind of the short answer, if you will. Thank you. And my apologies for the missed voice on the last few slides if you have any questions regarding sleep, or I think it was from sleep onwards that was an issue. So sleep, mental health, and creating new routine. I'm happy to address them, inshallah ta'ala, as the Q&A proceeds. Thank you.
Okay, thank you, Alatar. And yeah, we're sorry to miss the second part, but again, I know that we can get in touch with you if we had questions. And that note, we had another question, and I know you addressed it a little bit, but anyone can take this. What types of strength training exercises do you recommend in general, and any for 6 to 10-year-old children?
So for some reason, when I unmute, it says the host will not allow me to. FYI, I don't think the hosts are doing that on purpose, but just the FYI, that's what the message that I get. I was gonna defer this to Dr. Zargami to get his opinion, because chiropractors tend to have, mashallah, the best physique. I say that because, alhamdulillah, my chiropractor colleagues are people that we look up to when it comes to that. And one of them was my exercise, you can say, mate and best friend as well. So if I understood the question correctly, is basically what specific exercises in terms of which resistance training or physical training in general?
It said strength training, and then they also asked specifically for 6 to 10-year-old children.
Okay, so for strength training, so basically resistance training would include things like push-ups, sit-ups, and pull-ups, things that basically you're not, you're using your body weight and resistance to do. Overexertion would probably not be a good thing to do. I'm happy to probably get specific exercises, but I would say look at the needs of your children, first of all, like their amount of screen time, for instance, how much do you think they're doing, basically so that you can undo the damage. Because what you want to do is you want to activate muscles that are not being activated. So for example, if you're sitting for prolonged periods, then you want to do exercises that promote running, so that we can activate the muscles of the lower extremities. Arguably, you want to actually do activities that stimulate everything. So for example, things like swimming, horseback riding, team-based sports would all be in that category. I would advocate for that age group specifically to enroll in team play. Again, some may argue this is an anti-pandemic recommendation, but I think if the precautions are exercised, that's still doable in many ways. And I'm happy to address that on a private basis if there's any questions. Alhamdulillah, for example, any chance for you to do outdoor type activity, I would argue that the risk for transmission is, again, low. But in terms of what specific activities, I think you need to look at what kind of activity level you have a baseline and then address it accordingly. And I'm happy again to share more specific answers if there's for the people who ask the question.
Thank you, Dr. Alatar. Dr. Zargami, did you want to add anything to that?
Yeah, just echoing on what Dr. Attar was saying. Obviously, if you're not able to go outside, if you're not able to, you prefer, parents are being very careful for some reason, they want to be too cautious and not go outside. Best thing you can do next is just, we have some resistant bands in general you can purchase. You can get it from Amazon, you can get it from Walmart, Target. They're just very thin resistant bands that kids can use. Obviously, from the age 6 to 8, there's not much of strengthening or workout that you want to do to build those muscles. You want to activate the muscles that are not active. And the way to do that, just using a resistant band, what we call kind of the muscles on your back. So doing a little bit of back extensions can help. You can use your own body weight, or you can do what we call seated row, as if you're sitting and doing like a rowing of the boat. That's called a seated row, or doing lats pull down. So working on those muscles very lightly, not too much. Those can definitely help promote a little bit of more movement within the back muscles. Anything within the back, you definitely want to work out the muscles and try to get more movement within them. Simple stretches or any terms of any strengthening exercises.
Okay, thank you, Dr. Zargami. We have another question. I think this is more directed to Dr. Hassan. What are your thoughts on those blue light blocking glasses for children?
Okay, so the blue light blocking glasses for children. If your children are not wearing glasses already, I don't think most children will need blue blocking lenses that you would purchase separately, unless you're noticing that they're having issues with their sleep cycle being disrupted by their screen time use. So if they used to be good sleepers and now in the pandemic you're noticing they're on the screen more and bedtime is a little bit harder, you could try it and see it. Like I said, the only proven studies are related to sleep cycle, not related to eye fatigue from the screens or ocular health. So if you're concerned about sleep cycle, then you could try that. If that's not your concern and you are more concerned about are their eyes going to be damaged by so much screen time, then I don't think it's necessary at this time. Hope that answers the question.
Okay, thank you, Dr. Hassan. At this point, I don't see any more questions. So I would like to again thank Dr. Alatar, Dr. Hassan, and Dr. Zarghami for coming and talking to us about these really relevant health issues these days. And I know that we're all going to take some of these strategies and try to implement them in our own lives. Thank you to everyone for attending the RISE Education System Parenting Seminar Series. Please follow us on our YouTube channel to stay connected and receive updates. We have posted the link to the survey for this series of parenting seminars, again, in the Zoom chat and the description of the videos on YouTube. Please actively participate in the survey so we can plan further seminars based on your feedback. Thank you once again. And that's it. Assalamu alaikum. Have a great weekend to everybody.